So I'll move over to our next speaker, Faiz Ahmed. Faiz is a longtime trade unionist and socialist, and he'll be giving remarks about his experiences. Take it away, Faiz.
Thanks very much for that, Pam. Just want to do a voice check, mic check. Is this okay? Great, thanks. Well, good afternoon, everyone. I'm really only going to be speaking about the long-term care sector and the hospital sector within the province of Ontario. I'm not going to be touching on the home care aspects or some of the other medical services that are provided, just because that is not an area that I have very much experience with. But what I do have experience with is being an advisor to over various years, various different hospital unions and various different long-term care home unions. And I've prepared a bit of a PowerPoint presentation, which I'm going to share right now, and I'll just walk through that. Okay, so while it's easy to think about, or I mean, it's actually quite difficult to think about the catastrophe that's occurring as we speak, it's easy to forget what the conditions of healthcare in Ontario were prior to COVID-19, prior to the pandemic being declared. And I want to draw people's attention to the decades of restructuring of the healthcare sector in the province of Ontario. And you know, this really speaks to not only the province, but the country and throughout many parts of the industrialized world. But here in Ontario, as recently as far back as 2010, you have various governments, liberal governments, conservative governments, really thinking about how to reform the various public services of Ontario. So I just took a screen capture of the Ministry of Finance's current website. And this is the most recent report from the Commission to Reform Ontario's Public Services. What I've highlighted there are is the biographies of the various members. These are figures. I don't have to name them. They continuously pop up over the history of restructuring in the province of Ontario. You'll see that there's a whole section devoted to restructuring healthcare. Cost efficiencies are always a major aspect of it. You'll notice that at the bottom of this screen is Chapter 6, elementary and secondary education, but there's also post-secondary education. There's any single aspect of society that government touches. It's always talk about restructuring. If we go back 10 years, you look at the various reports that have been submitted and currently sit on the Ministry of Finance's website, where it's for, as I said, it's for decades, for many, many years, private interest, the banking sector, the consultancies have all seen healthcare as something to extract profit from. They're very clear that these things don't happen easily and that there is quite a bit of public support, but they're also very surgical in the way they want to approach it. And so this has been the climate under which our healthcare sector in Ontario has operated for quite a while. And it extends right up to the present day. So just prior to COVID-19 being declared a international pandemic, we had back in November, the Conservative government passing an ironically titled bill called the People's Healthcare Act. This act, the details of which have been closely followed by groups such as the Ontario Coalition of Health, the Ontario Health Coalition, very clearly identifies all the cuts that governments have identified that they wanted to make. And so this was what we were literally walking into in the province of Ontario weeks before this. I believe this act came out just 3 weeks before the WHO and China had first identified COVID-19 to have a potential catastrophic impact on the world. So that's sort of the history of how restructuring has always been on the agenda in the province of Ontario. Then we move on to, well, what are we looking at? What are the numbers of hospitals that the province of Ontario has? What are the number of long-term care facilities that the province of Ontario has? And again, you can find this information on the various ministries' websites. Very clear that there's 224 different hospitals in the province of Ontario. They continually get amalgamated. So you've got 145 hospital entities, but there's 224 sites. And that's just something that has become part of the restructuring of hospitals in Ontario, where government after government mandates that hospitals merge. And as a result, there are a number of downstream issues and effects that occur from a service perspective as a result of that. You look at long-term care homes in the province of Ontario. Again, you can find this information very simply on the public sites. There are 651 officially. A number of them, just for example, Providence Healthcare in the city of Toronto, are associated with hospitals themselves. So when you sort of subtract those out, you have 627 standalone long-term care homes in the province of Ontario. It's important to note that the long-term care home sector is outwardly open to privatization, and it has been privatized, in fact. And we're hearing about this every single day, that there are many private long-term care homes that are having massive outbreaks and unfortunately lots of deaths. But just to give you a bigger picture of how long-term care homes operate in the province of Ontario, 18% of them are publicly owned, so they're owned by municipalities. In fact, there is legislation which requires municipalities in southern Ontario to have to operate long-term care homes. It's a bit convoluted about why it exists in the south versus northern Ontario. Part of it is just because tax bases are greater in southern Ontario. 24% of long-term care homes are either affiliated with a particular religious order or not-for-profit. I mean, they're all not-for-profits. Some of them are affiliated with either the Catholic Church or the Salvation Army, et cetera. And then the vast majority of long-term care homes in the province are for-profit, 58%. Here, the private companies that own these long-term care homes are either massive corporations or they're private equity funds. And again, don't have to get into the details of how they operate, but it's basically investment-based, and profits are the underlying principle of those for-profit homes. The most important statistic, though, for you to remember is 100% of all long-term care homes and all hospitals in the province of Ontario are heavily subsidized by the tax base. They're publicly funded, 100%. Okay, so from there, we should just look at the latest in Ontario. So this is just news from yesterday. So here, news from yesterday, we've got over 10,000 cases of COVID-19 in the province. Of those, one in 10, just over 1 in 10 are healthcare workers who've been infected. And then, of course, this has been the news for the last number of weeks, that it's the long-term care homes in the province of Ontario that are the real epicenters for these breakouts. So the main points really to take away here is that the concentration of infections and deaths in long-term care homes is due to profit-seeking politics and corporate interests. Number two, the scramble for human resources at hospitals and long-term care homes is due to politicians and healthcare planners who are beholden to those corporate interests. And the third point to take away is that the solutions to these problems will be directly related to how much of the healthcare sector is publicly owned and worker managed. This is beyond a doubt. Every inquest that occurs after deaths at long-term care homes, every coroner's report that comes out, all point to the same thing, saying you need more staffing. Workers must have more input into how these places are run. So that then goes to just the general level of staffing and workers' rights in these places. So again, I'm only looking at long-term care homes and hospitals here. Very easy to find the information. So you know, if you go to the Ministry of Labor's website, you can see very clearly that hospitals and long-term care homes have very high levels of unionization, upwards of 65 to 70% in the province of Ontario. Of these, there are over 500 collective agreements only in the, just in the hospital sector, and between 500 and 550 in the long-term care sector. Numerous reasons why you have so many collective agreements. One is that the way the law works in the province of Ontario, the labor law works, is that it artificially divides occupations in these sectors by, they're essentially class-based, based on job description. So nurses are seen as very different entities from personal support workers, who are seen as very different entities than from cleaners, who are seen as very different entities from chaplains. It just goes on and on and on. And so this is an artificial division. It is the law. It is what it is. The other thing to note in the province of Ontario is that hospital workers and long-term care workers do not have the right to strike. We don't have to delve too much into that here, but basically it is just one other way of undercutting workers' ability to being able to influence how those places are run. They're just not, there's a trade-off there that is worth discussing or thinking about at a later date. The other thing is just the composition of these places. The healthcare sector as a whole is predominantly female. Lots of people of color who work in these institutions, and virtually everybody, the vast majority of people at least, come from working class backgrounds. So it is a very significant concentration of people who hold multiple identities, people who have various lived experiences, and people who know what is how things could work better for their communities, their families, and for the organizations that they work in. Unfortunately, even with the protection of collective agreements, workers do not have guaranteed emergency leave days. And where they do have paid sick days, they're highly discouraged from utilizing those few paid sick days that they may have. And there's all sorts of programs to use some, like just some union speak. It's they're called attendance management programs, if any of you are aware of them, where if you start taking the paid sick days that you have, you can still somehow find yourself terminated by your employer, depending on at the rate of which you're deemed not able to be at work. All of that being said, these are precisely the types of things, the types of calls put out by the Decent Work and Health Network that workers in the healthcare system need, because for them to have these protections means that society in itself is protected. It means that other workers are protected. There are so many other sectors that are inherently connected to the healthcare system of the province, where this particular crisis really starts showing those contradictions in a major way. So I thank you very much for your time this afternoon. And regretfully, I'm not going to be able to stick around for the questions afterwards. However, I'd be very happy to answer them in some forum at a later date. So thank you very much.
Thanks very much for that, Faiz, and thanks for joining us. We'll take you up on your offer to pursue some of these questions another time.